Hey everyone, today we are carving something different. We will carve a mandibular canine with a root. I know it will be our first carving with a root, so watch carefully our tips. First of all, I want to mention difference between maxillary canine and mandibular canine. Mandibular canines seem longer than maxillary canines, but all morphology is almost the same. We will carve a right mandibular canine, so don't confuse mesial and distal side. And now I will tell the measurements we will use. Crown length is 3 units and root is 4.5 units. So as you see in the picture, it's 11 and 16, but it's easier to use 3 to 4.5 ratio. And mesiodistal width will be 2 units. Also labiolingual thickness will be 2 units as well. When we compare labial view to maxillary canine, development grooves and lobes are less significant compared to maxillary canine. Mesial inclination of incisal edge is shorter than distal inclination. Tubercle is not as well developed as maxillary canine. As you see, distal inclination is a lot longer than mesial side. You can use 2 to 1 ratio, so distal is 2 units and mesial inclination 1 unit. So it's almost same with the maxillary canine morphology, but little bit differences. Now we will mark the corners. Here distal and mesial corner. Mesial corner will be higher than distal. Distal outline is more rounded than mesial. Mesial and distal outer line is more concave towards the cervical. And to the cervical part, it gets narrower. Also, there is a significant convexity on the closer part, the cervical of the labial surface. And here, if mesial side is 1 unit, distal inclination will be 2 units. Root is almost flat at the middle part and it gets narrower to the apex. And also, apex of the tooth little bit tilted to the distal side. Now we will cut with a plaster knife. Be careful while cutting the root. And we said if mesiodistal width is 1 unit, labiolingual width will be 1 unit as well. So we have to cut labiolingual according to this measurement. We will draw a cervical line, and this cervical line protects our ratio with the teeth and the root. We will draw this cervical line above our measurement. If we draw this line under our first measurement, crown ratio will be higher. So we will draw our cervical line above this first measurement line. So we will protect our ratio and root ratio. Now we will create our two surfaces on the labial. We will round the mesial and distal sides. And we won't take from the middle part here from this ridge. Now we can continue with the mesial side. It's better to draw cervical line on the each side. In a mesial view, it looks like a dagger shape. Apex of the tubercle is sharp, less developed cingulum and thinner form ridge compared to the maxillary canine, and also apex of the tubercle is located obviously at lingual, so we will cut closer to the lingual. Labial outline is less convex compared to maxillary canine. Lingual outline can be seen first concave, then convex, and then concave from cervical to incisal, and cervical line is closer to the incisal. And for distal, it looks smaller and shorter than mesial surface. Development grooves is apparent on the root surface. Cervical line curvature is less significant compared to mesial surface. Outer line looks like a mesial. Now we will cut excess soap particles from the root. And now we will round the corners of the root. When we look from mesial, tooth gets narrower to the apex. So here from notes, as you see, first at the middle it looks flat and then gets narrower to the apex. But cut careful here, like this. Unfortunately, root is broken here, so it can happen to anyone. Just be careful and continue carving. Now we will shape developmental grooves here, like this on the labial side. And time to time, we use sponge to see better. Make cervical line clear, so it looks better. And now for the lingual view. Lingual surface has more significant morphology compared to other mandibular anterior teeth, but compared to maxillary canine, it's less obvious. And here, almost done. Now we will carve lingual ridge and cingulum. We can draw the M letter again. Lingual ridge significantly divides tooth into two pieces. Cingulum is significant but shorter than maxillary canines. Distal outline is rounder than mesial. Significant mesial and distal fossa. It's a little bit hard to carve small teeth, but you will get used to. Small adjustments are fossa and lingual ridge. So while using sponge, don't push too much because root may be broken like we did. Now we are doing small adjustments on the root surface. It's a little bit thick. And our carving is finished. Now we will check each side. And here distal inclination is longer. As you see, if mesial is 1, distal inclination about 2 units. And more rounded than the mesial side. Apex is a little bit tilted to the distal side. We have 2 surfaces on the labial side and 2 developmental grooves here. And here we have 2 fossas, and the middle there is a lingual ridge. Distal looks like mesial side, but cervical line is more flat. And from incisal view, here we see 2 surfaces on the labial, mesial and distal, and here 2 developmental grooves, 2 fossas, and teeth gets narrower to the cingulum. After checking, we will use socks to eliminate knife marks. Then we will use satin to polish. Good luck. See you in the next video.